I went to 3 dentists over the past 8 years inquiring about an old root canal that I had had done. After doing tons of research and hearing lots of stories of latent infections brewing at the jawline where people had root canals, I was very concerned for myself. I also really wasn't taken seriously. I had one doctor do an x-ray and poke around in my jawline and say, do you have any pain? It seems to be intact. There's no crack. Everything looks great. Why would you want to mess with it? I messed with it. I found a biological dentist not too close to me, but not too far, that was willing to listen to my concerns. We did a head CT scan, which scanned my entire jaw and head. And what did we find? A big pocket under my root canal that more than likely contained bacterial infection. And it's important for me because I've been dealing with chronic Lyme disease for the last 15 years almost, and have had a low white blood cell count, which means my body is fighting infection. Whether it was the Lyme disease or whether it was the root canal, I don't know. And worse for me, when she took the crown off the tooth and uncovered what was left of the tooth, they had also left an amalgam filling, mercury, inside that tooth, which has been slowly leaking for the last 30 years. So the tooth is out. She did some ozone. She's a biological dentist, so you'll need to see a specific dentist if you're dealing with removing a root canal. But she did PRP, which is when they take your blood and spin it and re-inject the fibrin right back into the site. Ozone gave me homeopathics, actually sent me home with this little bottle that was full of water and all of these homeopathics, sent me home with a grounding pad that I actually tape to my face at night and plug into the wall. As well as some high-dose Arnica montana, which is another homeopathic for lowering inflammation. I did a little protocol on my own of a drainage activator, lymph active, because in fact, after the removal, my lymph was a little bit swollen, and some binder to bind up any of that bacteria that got into my system. So the point is, if you have an old root canal and you have any kind of health issue, consider having it removed. At least go to a biological dentist and get the scan, not just an x-ray, but you need a CT of the jawline to understand what's underneath there that could be causing infection. It is yet another root cause of problems in the body. So get it taken care of. If you like this information, follow for more. I talk about all kinds of alternative health.